Hello, everyone, and good afternoon. My name is Ginny Mantello, and I am here today not as a physician or a public health professional or the director of health and wellness. I am here today as a concerned parent of 2 teenage boys and also a concerned community member that spends most of her days thinking about the health and well-being of the youth in our community. Over the next few minutes, I will hopefully make a case for what I believe is compelling evidence pointing us towards the fact that we might be on the brink of a mental health crisis in youth, one that we should not ignore, and certainly one that we cannot be addressed without the participation and voice of those affected, the youth. Don't get me wrong. I am the proud mom of 3 very smart and talented children. At least one of them is very handsome also. My oldest graduated from this very high school in 2010 and recently finished her medical school and is starting her psychiatry residency at NYU. My 2 younger children are teenage boys, one of whom is a freshman at Tech. I really believe my kids were smarter than me from the day they were born. And you know what? They knew it. And they certainly were not shy to tell me that. Must be all those prenatal vitamins I took. My husband and I have made our children our biggest priority. We never did anything without them. And much to their dismay, we never go anywhere without them. I'm sure now that they're teenagers, they wish that we would leave them alone for a little while. So then you might wonder, why am I so worried? Maybe everything is all right now, but I know that things can change very quickly in this rapidly evolving environment. Soon they will be off to college, and I won't be there eating dinner with them every night, listening to how their day was, or even just having silly arguments with them every night on who's right or wrong on a particular issue. And we know that this is not the norm in most homes these days. Parents work long hours. Families rarely eat dinner together, and children spend hours alone in their rooms, behind closed doors, on their devices, late into the wee hours of the night. Does that look familiar? So I took this picture and a couple of the data points that I'm going to show you from an article by Dr. Jean Twenge, and the article is titled, "Have Smartphones Destroyed a Generation?" I don't know, I'm not really sure of that, but I think the data behooves us to dig further. Now, Dr. Twenge, in fact, says psychologists like herself have been noticing an abrupt shift in teenage behavior and emotional states. This generation, unlike previous ones, is showing some sharp, distinctive characteristics that have never been seen before. So what's changed, you ask me? Well, fundamentally, how we connect has changed. Humans are social beings that need to connect, not just physically, but also mentally and emotionally. And if we don't, if we live in isolation, we regress. We have always connected through touch, through expression, through sound, through love. A lot can be communicated without words, just by body language and through our expressions. Certainly not things we can communicate through a text message or our millions of followers can tell us about. I do think the children of this generation are more connected than ever before. In fact, you might say that they're hyper-connected or super-connected, if those words exist. They're constantly connected every minute of the day and into the night. It's just that how we connect today is different. We connect through texting, emailing, Snapchat, Instagram, Twitter, Facebook. Wow, I think my kids would be impressed with the number of social media handles I just named. We can even play games with each other on Xbox, sitting in different parts of the world. We are more connected than any other time in history. We have amazing ways to communicate with one another, no matter where we are. But the question I have for you is, are we really connected at all? Well, teens who spend a lot of time on screen activities, they've found, data has shown that they're more likely to be unhappy than those who spend more time than average on non-screen activities like sports and playing outside. They're likely to be more happy. And that's not all. We're seeing a lot of other scary trends. There's data that's been collected by NIDA, and that data shows that these days teens are less interested in hanging out with friends. They're indoors most of the time. So in addition to that, we've also seen that teens are more likely to be lonely. And that's not all. What else are we seeing? Data from the National Survey on Drug Use and Health that's been collected by SAMHSA, the Substance Abuse and Mental Health Service Administration, for decades. And they have data for over 600,000 individuals aged 12 and older, and it's showing some really startling trends. Not only are youth more unhappy, but more teens and young adults are experiencing loneliness and depression and attempting suicide and succeeding. Even the age at which they're attempting suicide is significantly younger. The first signs of a problem emerged around 2014. More young people said they felt overwhelmed and depressed. College counseling centers reported a sharp increase in students seeking mental health services. So what happened in 2014? Well, for one, we know that the number of young children using iPhones hit 50%. We also see that serious mental illness is rising at a much faster rate in young adults than in older children and older adults. Depression has surged 66% in youth 12 to 17 years of age, and 33% in youth 18 to 25 years of age. And that's not all. As I mentioned, we're seeing increase in suicidal thoughts, plans, and attempts in all ages in young adults. Suicide rates among 18 to 19-year-olds climbed 56%, and emergency room visits and hospitalizations due to self-harm and suicide attempts have increased. This increase has been more pronounced in young women and girls. We're also seeing serious psychological distress, which includes anxiety and hopelessness, has jumped 71% among 18 to 25-year-olds from 2008 to 2017. Interestingly, this mental health crisis seems to be a generational issue and not something that affects Americans of all ages. The largest increase is being seen exclusively in teens and young adults. And in those born in mid to late 1990s, the so-called iGen, or Internet generation, a term that was coined by Dr. Twenge. In her book called iGen, she talks about why today's super-connected kids are growing up less rebellious, more tolerant, less happy, and completely underprepared for adulthood, and what this means for the rest of us. So while there might be many reasons for this shift, the one thing that stands out is the introduction of technology into the lives of our children and how they interact with it. How we interact with each other has also dramatically changed. And this change has been extremely rapid. So rapid that no one, not us parents, not educators, doctors, scientists, researchers, and least of all the affected youth have been prepared for the consequences or have the tools to fix the problem. So today, I want to challenge you, the brilliant minds of today and the leaders of tomorrow, to think about some of what I've shared with you and think about how you can do your part, not just for yourself, but also for your school and the community at large. Never before has there been such a rapid spike in mental health and substance use issues. So what is going on? We need to dig deeper, and here's where you come in. We need your help, because we certainly cannot fix this problem or understand it without your help. So as a public health physician, I and others in this field began to look at this data and really worry about some of these trends, as well as look at some of the potential causes and dig deep. On Staten Island, we found that there was a lack of preventive services, lack of social emotional learning programs in our schools, and a lack of early intervention programs. Our children lack resiliency, and many of them do not know how to self-regulate. So given that, and given that there was lack of services, the borough president and other public health partners advocated to the state and to the governor, and we were able to get more substance use prevention counselors in our school and get resources to expand social emotional learning in many of our high-need elementary schools. Another flaw in our system is that we have always focused on physical health more than mental health, and the two have never been integrated. It's mind-boggling that physicians don't look at the child holistically, and they do not perform routine screenings for mental health at pediatric visits. Considering that 1 in 5 youth experience a mental health disorder, and according to NAMI, the National Alliance on Mental Illness, the average delay between symptoms and someone actually getting an intervention could be 8 to 10 years. We, physicians, are clearly dropping the ball. Additionally, 50% of mental illness occurs by the age of 14 and 75% by the age of 25. The majority of children that are diagnosed don't even get the care they need. So there's a huge gap. If you don't address this and take timely action, the issues can escalate and get to a point where they are hard to treat. So in order to address this problem, my office and I, along with the Child Mind Institute, started a pediatric mental health pilot in multiple practices on Staten Island and one large hospital-based pediatric clinic. Parents and adolescent children are asked to fill out a simple mental health screening questionnaire via an iPad while in a waiting room. The results and scores are generated instantaneously, allowing the doctor to then screen the child further or refer them out to a licensed social worker or a mental health professional. We've been collecting a lot of data through this, and in addition, we have data through the Healthy Brain Network, which is part of the Child Mind Institute. And the data shows that there is a large number of children that we screen that have ADHD and that also have anxiety disorder. You heard about that. It also shows that over 60% of these children, this was the first time they received a mental health or learning disorder diagnosis, which then enables them and their families to seek out early intervention to vastly improve the quality of life. There's also compelling results on hyperactivity and also on emotional problems, eating disorders, bullying, suicide, as well as the mental health and substance use disorders co-occurring. We see that there's correlation between a lot of different mental health disorders. For example, suicide is significantly correlated with emotional problems, hyperactivity, eating disorder, and depression. So why am I telling you all this? Well, for one, you heard before, you should definitely think about it. and think about what is it you can do. So I want to end with this question. What is it you can do? Well, start with simple things. Put down your devices for starters. I'm not saying that you should get rid of your iPhones and your iPads. Parents should take them away from you, but put them down for a little while at a time. Don't be dependent on them so much. I hear children sleep with them at night because they get anxious if they don't have their phones with them and their devices. And they get comfort from sleeping with them. Spend time with friends in person. You heard before, find that one or two or few friends that you can connect with. Go outdoors with them. Spend some time experiencing the simple pleasures of life. Growing up, I remember spending every single day outside with my friends. Be more mindful and present. Practice some meditation, deep breathing, and yoga. Pay more attention to the surroundings, your parents, your siblings, to nature. And you're going to hear a little bit more later about the importance of mindfulness. We also have started a mindfulness program in multiple schools, and we're trying to work with the superintendent to bring it to all schools. And there's a lot of benefits of mindfulness. What else can you do? Well, increase the awareness of mental health disorders and help reduce the stigma. There's a huge stigma around it. Talk about it. Help reduce that stigma. Advocate for more prevention and early intervention resources in your school. Add a youth voice. Join your school wellness council. I know you have a wellness council here at Tech. Join that council and put a youth voice. We need that. Help prioritize cultivating a culture of health and wellness in your school. I know you have a principal that believes in it. So help prioritize and work on those issues. And then if you have an opportunity, mentor children younger than you. So with that, I want to leave you with a personal belief and something that from experience. Connections are made through the heart and the mind, not through texting and social media. Thank you.